Hi, everybody. Thanks for joining me here on Conversations for Yoga Teachers. I'm your host, Karen Fabian, the founder of Bare Bones Yoga. I am a yoga teacher with many years of experience, a certified personal trainer, and an entrepreneur. My mission is to show you how to get confident, speak clearly, feel authentic, grow your impact, earn your worth, and build a community. For years, I've been working with teachers in my signature program, the Yoga Anatomy Blueprint Learning Program, and I've seen so many teachers transform, and I can help you get there too. On the podcast, you'll hear anatomy lessons, stories from teachers, interviews with others in the field, and a dose of personal development. In addition to the podcast, don't forget to also follow me on Instagram and TikTok for daily videos on teaching topics. Thank you so much for taking the time to listen today. Let's get into today's episode. Hello. Welcome to Conversations for Yoga Teachers. I'm your host, Karen Fabian, and this is episode 216. So I am recording this on December 1st. Oh my goodness, can you even believe it? On December 1st. And what this episode is going to be is an interview, and I'm going to tell you a little bit about today's guest in just a moment. I recorded this interview on the 28th of November. So today is Thursday. I recorded it a couple days ago on Monday. And this episode that you're listening to is going live on Monday, December 5th, 2023. So we are 2022. So we are headed towards the end of the year. Before I tell you about our guest, I want to just briefly tell you a really cool story about a realization a teacher had. And I'm telling you this story because I wonder, as you listen to this, if anything about this story resonates with you. So I had a teacher enroll in my program within the past week or so, and she had a not so great experience in her first yoga teacher training, her first 200-hour teacher training that she recently graduated from. The overall experience was not great, and especially the anatomy portion was not great. So she was left feeling somewhat burned and definitely did not feel confident. What she did, though, was really amazing. She took it upon herself to go out there and search out for friends and offer them free yoga classes. And she did this. And after every class, she was asking those people for feedback. And so as a result, she was getting feedback from a lot of people, but she still wasn't feeling like she was progressing. She was still really nervous. She was doubting herself, all of which is definitely part of being a new teacher, but definitely is an uphill battle for her because her initial training was so poor. So when we had our first training session this week, our first coaching session, because when you enroll in my program, the Blueprint Learning Program, a really important part of what I do with you is we work one-on-one together in coaching calls on Zoom. And in this first coaching call, I asked her, what would be a really great win for you in the next hour, that we're meeting together here? What would be a win for you? And she said, Karen, if I could have more confidence as a teacher and I could feel that, that would be a win. And so what I did, and I said, okay, well, what area of teaching are you having the most struggle with right now? And she said, absolutely sharing cues. And so what I did, and I'm not going to tell you how I did it because it's part of my secret sauce, but what I did with her over the next 60 minutes, not 4 hours, not 3 weeks, not 2 days, hour, is I shared with her one of my strategies, especially for new teachers, but not just for new teachers, around how to share effective cues. And I helped her also see how she could leverage skills she already had to share better cues, especially her role as a mom. And so at the end of this session, she taught me a series of Sun A and Sun Bs, and I felt like I was in the presence of an experienced teacher. She was calm. She was grounded. She sounded like herself. She didn't sound like she was pretending to be like anybody else. And when we were done, her eyes lit up. And I kid you not, I swear to God, she said, Karen, I can't believe how easy this feels. And so if you're listening to this and this resonates with you, do not wait to get in touch with me and set up a 60-minute session so I can show you how you can leverage skills you already have, how you can increase your confidence, and how you can share effective cues right away, not only to help you feel more powerful and effective as a teacher and confident, but so you can better help your students. Because if you're nervous when you're teaching, if you lack confidence, if you're having trouble finding your cues, it's not helping them. It's making it harder for them. So this isn't just about you. And I want you to keep that in mind, because if you're out there and you know you need help and you're not getting it, you're making it harder for your students to practice, to learn, to grow. So you not only owe it to yourself, you owe it to the people you are trying to help to improve as a teacher. And that sometimes means investing in your growth, which means spending money and not being on the endless free content wheel of trying to figure it out for yourself. Now, of course, this session I'm offering you is no strings attached, 100% free. And all you need to do to set it up with me is send me a DM on Instagram and let me know you want to do it, or send me an email, Karen@barebonesyoga.com. All right, so that is it for that. Today, in today's episode, I am so excited to share with you this conversation I had earlier this week with Dr. Trish Corley. Dr. Corley is a licensed physical therapist and an internationally recognized yoga and anatomy teacher. And she and I have a very detailed conversation about not just the importance of understanding the key aspects of anatomy for yoga teaching. We also get into several different themes and trends and things yoga teachers say, things that are ingrained in the industry that don't make good anatomical sense. And it really, for me, was like speaking to a kindred spirit, because she and I both have this love and this passion for anatomy. She is, of course, a physical therapist. Additionally, I started out thinking I wanted to be a physical therapist and went to PT school here at Boston University for the first 3 years of my undergrad education. I ended up graduating with a degree in rehab counseling and ended up working as a rehab counselor in the clinical setting with physical therapists and occupational therapists. So I have this connection with her, not only in that academic training and background, but just in the fact that we share this passion for anatomy and making it easy to understand. And this is what Trish does so well. So I'm going to go up into this episode now, into this interview now, and you can listen at the end for information that Trish shares about how you can stay connected to her, how you can follow her on Instagram, and how you can find out more about the programs she offers. So with that, let's go to that interview with Dr. Trish Corley. Hello. Hi, Trish. Can you hear me? Yeah, take a moment, get yourself, it sounds like you can hear me, but I can't hear you. You can't hear me. Okay, 1 second. Let's see. Let's see how we can do this here. That's funny. Why don't you take a look on your end and just see?
I got it now.
Hi, how are
Last
you?
night, Karen.
Very good. Nice to meet you.
Nice to meet you too.
These opportunities when I have never actually met a person in real life and I'm chatting with them on Zoom, having connected with them in a variety of ways. So I really appreciate you taking the time to do this, and I'm super excited to learn more about you.
Yeah, well, thank you for having me. I'm so excited too.
Of course. I think sometimes too, I always share that little blurb because sometimes when people are listening, they might wonder, well, how do these two know each other? And sometimes I do have people on who, I might know from some different situation. Maybe we were yoga teachers together or whatever the situation is. So yeah, so this is really our first opportunity to meet and talk. And I love those sort of things because it's kind of like if I were to meet you at like a cocktail party or at Starbucks and we just happen to strike up conversation. So it'll really just kind of be like that, a chance for you to share, not just with me, but to the listeners, a little bit about you and what you do and what you love about what you do. So I'm just going to kind of start off the conversation with a couple of just easy questions. How does that sound?
That sounds perfect.
Okay, great. So why don't you start out? I'd love to know a little bit more about, I know, of course, we share yoga teaching in our backgrounds, and I'm not going to go into it too much because I want you to share the anatomy piece. I would love to know a little bit about how you got into teaching and especially the anatomy piece.
Yeah. So I'm a physical therapist before, I think I may have taken a few yoga classes here and there. And I always joke that I was training for marathons and doing the hardcore exercise thing that my other PT student colleagues were doing. And I went to yoga classes at Boston Sports Club, actually, when I didn't really feel like going to the gym. And let me back up. My background, I was a gymnast. I was a competitive gymnast. So when I first approached yoga, it was kind of easy and boring because I didn't really know what I was doing. I just was like, oh, like stand-in warrior with your arms out. That's easy. And so that was like my first, I wasn't really into yoga. And then while I was in PT school, actually, I started training for a marathon and ran it successfully, and then had a lot of aches and pains for months. Signed up for another one and thought, I got to do a little bit more than that, like 2-minute stretch before and after a 15-mile run. So I committed to like one yoga class a week as part of my training. And then I ran another marathon and I was only muscle sore for a couple of days. And I, like most yoga students, realized like you get a lot more out of going to yoga class than just stretching. And so I kind of, I guess, bought into, I don't know. I don't like saying buy into it, but I got the benefits, like the spiritual benefits, the mental benefits, plus the physical benefits. And so that just got me more and more, like I started doing yoga more regularly. And then in my physical therapy career, I sort of had I was working in Houston at Texas Children's Hospital, and I loved it there. I wasn't looking for a new job, but I was looking to change something up a little bit. Like as PTs, we always have opportunities to, try out a new certification or like go to a different department or something. So I kind of had that in my horizon when the director of the physical therapist assistant program at San Jacinto College opened up, and an email landed in my inbox. And long story short, I took that job. So I was then told, you're teaching functional anatomy, which I really wasn't thrilled about because I struggled with anatomy in PT school. But I figured it out, and I'm so grateful for that because I really looked at it like every student is going to be challenged with this experience. So how can I step up and make my teaching accessible and actually teach them to learn it and use it rather than just memorize some spreadsheets and the way I approached it that didn't really work so well. So that's kind of where I got to teaching the anatomy. And then that first year as a professor, I had spring break in the studio I was practicing at regularly. It was Yoga One in Houston. And they offered a teacher training that was like a 10-day immersion plus several weekends. And that 10 days was during my spring break as a professor. So I did it, kind of just like, that'll be fun to do. My husband and I had already gone on a big trip, so he didn't want to travel. So I did it. And like many of you that are teachers and listen to this, you'll probably identify. I did the yoga teacher training because I just wanted to learn more, but then all of a sudden I wanted to teach it. So I got teaching it, and it was a great yoga teacher training, and the anatomy part of it was not great. It was, I hate to say it, but pretty terrible. And I'd been looking forward to it.
I hear it all the time.
Yeah. And I was like so excited for that day, just to, I think what I had expected was for me to maybe know the anatomy, given I was teaching it at a college level, but to like learn new ways about thinking about anatomy, or how to approach anatomy in the yoga teachings and yoga practice. And I unfortunately didn't get that, or let me rephrase that. I fortunately didn't get that, because it really inspired me. I was like, I've got something here to give. And so actually a year later, I taught the anatomy at that studio's yoga teacher training. And really from there, it started developing different ways of teaching yoga anatomy, and from that studio to other studios and so forth. So it very organically happened. And now I just love it, though. I always say, like, even though I hated anatomy in PT school because it was so stressful, I actually do love anatomy and like the human body and learning about it. And so I get totally lit up teaching yoga anatomy and inspiring people to like learn how to apply it and how to use it, and not just memorize, the origin of the biceps and the insertion of it and its nerve innervation, because that's useless unless you really know like how to use it or what it means. So
yeah. I can totally relate, because I was in the Boston University PT program for the first 3 years I was in school. So I can relate to the stress of learning anatomy in that context. I'm curious to know more about when you were just sharing about your experience as a student in that training, and whoever was coming on board to teach the anatomy part. And if I remember correctly, you said something like you were hoping for more than just learning about the muscles and that kind of thing. You were looking for like how to apply it. Tell me a little bit more about that, because I bet that's a lot of what you share when you teach. And so I'm curious, and especially for people listening who had a similar not so great experience in their teacher training when it came to the anatomy part, and sort of look at it in this very linear way. There are these muscles, I need to learn them. Each muscle has an origin and insertion. I need to memorize that. So what's the different way to approach that?
So one thing I teach now at the start of, if I'm, whether, depending on what program I'm doing, but at the start of it, I really want people to understand just how muscles work. And I think that that's often lacking. We tend to think of, muscles tighten up to move, which they do, but getting people to really understand that muscles have a variety of ways of working. And I try to keep it, very simple, but really teaching people that, yes, muscles have an origin and an insertion, and you don't need to memorize them, but you can look at a picture of a muscle and see that there's a place that it's, and one end of it, sorry, my earphone just fell out. At one place of it, it starts at one place and ends at another. And even if you don't know where it starts or where it ends, just learning to understand that muscles are like pulley systems. And they're not just like pulley systems, but I try to simplify it and just teach people, like, if the muscles in your bicep, say, for example, it's up by your shoulder and down below your elbow. And if you look at the lines that the muscle fibers create, if that muscle shortens, it's going to act like a pulley and just make your elbow bend or make your arm raise up. And also knowing that that goes in the reverse way, and that we use an eccentric contraction to control those. And so a lot of times what I do is, spend a lot of time teaching people that, using like a red TheraBand on the skeleton to give them, a visualization of how it works. And then we go through the key muscles, and I tell people, if you come, especially if I'm doing a weekend immersion for a 200-hour teacher training, I don't want you to learn every single muscle. That's just ridiculous. But to get the key muscles and then look at pictures of them and really study them, like look at it and imagine what it could possibly do. And then we do that on the skeleton, and then we do it in the physical bodies in yoga, and like maybe with a simple thing like bending your elbow, but then we move it forward into, okay, like what yoga postures do you bend your elbow in, and how is the bicep working in that example?
Got it.
Yeah, and that's kind of my approach. And it makes me think, when I was teaching at the college the first year and thinking like, what are ways I can get people to really look at to really understand this? One of the first things I did, and I just giving me an idea, I don't do this in the anatomy course, yoga courses, but maybe I should. I had everybody go to the window and just look out the window and tell me what they saw. And of course, at first, they saw a building or the yard, or, and I said, well, keep looking. What else do you see? Keep looking. And almost like an art piece, that the more you keep looking, you actually see stuff, as opposed to, let me tell you, there's a building to the left and a yard to the right and a car down there that's blue. Like, let me have you spend time looking and appreciating and discovering for yourself what you see. And so I also add that, just that generalized concept in like having the students in the yoga anatomy courses look at, identify where the biceps is, and I'll help them find that and say that's the bicep, but then get in different yoga poses and look at that bicep. Choose, yoga poses. I mean, by the time I'm in there teaching people, they can identify at least 20 different yoga poses, and I have them get into different yoga poses and like see for themselves what's happening. So I think that's another way of approach that I use that I find really helpful, so that people aren't trying to memorize what I'm teaching them, but rather discover it for themselves, and then it becomes theirs to practice on themselves and to teach other students.
Yeah. And I mean, that's really what you're describing. Look at a person in a pose and identify the muscles that are in action, meaning contracting, not even maybe eccentrically lengthening. That's such a real life practical way as a teacher to not only learn the anatomy, but in addition to be able to look at a student on the mat and have a sense of not only what's happening, but if something's not happening in terms of an alignment thing that you want to be happening, what might possibly be the problem.
Mm-hmm.
And so that sort of leads me to my next question. What's your thoughts on the relationship between understanding anatomy? And I love how you focus on like the key muscles, not all muscles. And the other thing you said was, how muscles work, not down to the nitty gritty level of like ATP and mitochondria, but like at the global kind of higher level of types of contraction. So I'm totally in the same zone as you in terms of that. What do you think, though, about the relationship between the cues a teacher shares and what they understand about movement, meaning anatomy? How if it's a teacher wanting to cue better, what do they need to know more about? How do they identify that? And maybe just in general, is there a relationship there between those two things? I'm not sure.
Yeah. I think I'm tracking where you're going, or what you're asking.
Because it really, let me just add a little bit more. It's really, in my mind, a matter of, I can say a bunch of things and not have an understanding of just the fundamentals, or I can say a bunch of things when I'm teaching and have an understanding of the fundamentals. And so there's a relationship in my mind between those two things. The more I understand about movement, the better I can share cues. So that's the relationship. I'm curious about what you think about that.
Yeah. Well, so from my yoga teacher trainings, I've certainly had some different methodologies, and the True North alignment practices from Baptiste Yoga. A lot of my trainings are from the Baptiste Institute. So and even my trainings before that were inspired by those. And so I think having a set of alignment cues, and which I've now adapted the true north alignment into what I've created as optimal postural alignment. It's a lot of the similarity there. However, just from my experience of working with thousands of yoga students and physical therapy patients, finding ways that maybe have worked for me to create a better or more simpler message. So it's what I've created, I've adapted from what I've learned over my experiences. But I do think it's really powerful to have a set of cues that one could memorize, but then to really be able to understand the why. And I think I approach it that way as a physical therapist. I spent 3 years studying anatomy and movement and working under mentors of other therapists. And I also can tell you, I've been a PT for 20 years now, and it probably took 5 or 10 of those for me to like really be confident in looking at human movement and really analyzing it and understanding it. And I'm still learning. So for those reasons, it's not realistic for me to impart those skills into a yoga teacher who's doing a 200-hour training or even a 300-hour training or even a mentorship, because it's just beyond the capacity. So I go back to having like a set of cues that they can memorize, and then playing with the discovery of the why. So almost like reverse. Like I feel like in my doctorate PT program, like we learned the theory and the understanding for a year and a half before we got to go see patients. Whereas I approach it differently with teaching yoga students that here's this, learn this, practice this, and all along ask why. And I will say, I find that the challenge to get yoga teachers to get confident in asking why. And again, I think it's just the level of a training at 500 hours is not as in depth as a doctorate level program. And when I was a professor in a physical therapist assistant program, that was it. Like people would, every time they teased me, why do you always ask why? Why do you always ask why? Well, because the why is why you'll be able to keep making better and better decisions in the future. And so I do feel like it's really important to get teachers asking the why, but I like to give them something simple to, I'll say, memorize, so that they have something to start with, and I think most yoga teacher trainings do tend to teach people what cues to say. And I think there's a lot of value in that. I think it can fail us, though, if we say, well, just say this because I said this, or this is what the teachers say before. And I think, I've seen a lot of that just out in social media and in conversations with teachers of one of my favorite is, don't put your foot on your knee. Well, why? Like, just why? Who says that? And I can go into that too, but and then sometimes people are like, well, I never thought of why, So I guess in summary, like I do have the optimal postural alignment cues that I teach. Like here they are. I can put them on one piece of paper, so you have a skill set and a tool to fall into. But it's not enough to just memorize it. You got to start asking the questions and discovering the why if you really want to become, the most effective yoga teacher that you can be.
Yeah. And I think for people listening to this that have been listening to my show for a while, they're going to be amazed, because a lot of what you're saying are super similar messages that I say. I very consistently talk about the why behind the cue. And in fact, I've used that example in tree pose as a good example of a situation where teachers are taught a particular cue with that kind of tagline warning, put your foot on the side of your leg. Oh, but not on your knee. You could damage your knee. And it's sort of like the telephone game. It just like proliferated for years and years and years as a warning in the teaching of that pose, with very little questioning as to why are we warning people about that? What do we really think is going to happen? Is a human being even capable of putting so much pressure on the side of their knee in the 5 seconds they're standing in that pose, maybe even 7 days a week for 5 seconds? Like, how much course do we think is good? But again, as you said, and as you went into so wonderfully, I don't know if it's the relationship between a student teacher and a mentor teacher that they sort of abdicate. Well, that person must know what they're talking about. So if they say that's a warning I should give for tree pose, I should give that warning.
Yeah.
And like you, I'm always encouraging teachers to ask the why, because just like you said, when you understand the why, you're building the knowledge about whatever that cue is, so that when you share it, maybe even in your own words, it can be shared with much more conviction because it's coming from a place of what you know, rather than just what you've been told to say, which is always, in general, a very disempowering way to teach. Although I agree with you, everybody starts out with a set of cues to lean into, and that's the only way you can start.
Right.
I think what I'm hearing you say, maybe in not so many words, I'm just sort of paraphrasing, is that I'm sure you're going to agree with this, although I've sometimes run into teachers who question, like, well, how much do I really need to understand anatomy anyway? And I can remember a teacher that I was doing a training for, and in fact, she had hired me to teach anatomy for her 200-hour teachers. And in a sidebar conversation, she said, well, I never really focus on anatomy anyway when I teach, so I don't really feel like I need to use it or learn it more, but I just offer it because it's part of the 200-hour training agenda. So I know that's sort of on one end of the spectrum perspective, but I'm curious if you could share a little bit more about, like, how is understanding anatomy so central to teaching yoga? I mean, of course, there's the 8 limbs, and there's different kinds of lenses we can view yoga through. We can view it through a lens of its functional movement. We can view it through the lens of the style of yoga, or maybe who we are and what we choose to focus on. Maybe I'm very much into Eastern medicine, so I'm going to focus on energetics or chakras. Is there some commonality that exists that basically says we're all essentially teaching movement, so there needs to be some understanding there? So I'm kind of curious what your thoughts are on that.
Yeah, and I've kind of gone around in circles on that. I always joke that when I first started, even seriously practicing yoga, I'll say, not those days back when I went because I didn't want to work out, but when I really got around like yoga teachers and started teaching yoga, there was a lot of people that I met that were really into the energetics, the chakras. And I was this like Western trained physical therapist, Dr. PT, like research, evidence-based, like all those words. And I was like, get away from me if you're going to tell me I got great energy. Like I have yoga teacher friends be like, you have such great energy, Trish. And I'd be like, that's weird. Thanks. And then the more I got teaching, I started really realizing like those energetics were actually like my nervous system is all energy, like just electrons and protons and chemicals, and it's kind of all the same. And then I keep leaning into that, and then suddenly I see around me that everything's physically connected. And so then I started taking this new approach, like, well, your body is the physical practice. Like whether you're sitting and meditating or you are, practicing the different limbs of yoga or any of it, like it's my body that I live in. So even if I'm doing philosophy or history, it's my brain that's learning it, or my body that's feeling and connecting. And I'm actually reading The Body Keeps the Score right now, and was discussing it with my husband and my sister-in-law over the holiday, who she's read it and has a master's in, I don't know what the topic is, but something about trauma and neuroscience. And so my husband's question was like, so is the book about like the brain or the body? And I was so quick. I was like, you can't disconnect them. It's all one. And so coming back to your question about like the anatomy being the essence, or I just said it, here it is, the anatomy being the essence of particularly the physical practice. I mean, you can't do yoga asana without your anatomy. I don't think you can meditate without your anatomy. I don't think you can study philosophy without your anatomy. So it becomes also necessary. And then I think, you know, the level to which one needs to understand it, I think it's like the poses. If I'm going to teach you what warrior two is, I got to know that like one foot's forward, one foot's back, and arms are out to the side. And there's a couple options where I look, you know, that's the basic. And then I can advance into my skills and sort of discover where should my shoulder blades be aligned? Where should my pelvis be aligned? And so I think then we just keep learning more and more. And then that empowers me in my own practice, and teachers to be able to really give those fine cues that people then get connected to their bodies. You know,
Right.
that's my experience of a really skilled teacher, is able to look at me, who I've been doing this gymnastics, dance, yoga, physical therapy for my whole life pretty much. And when a teacher can look at my pelvis and say, lift the front of your pelvis up towards your ribs a little bit more, I'm like, oh, and then I'm just like present to my body right there. And it's so powerful.
And I want to just pause there for a moment, because that's such a great example. And I'd love to know a little bit more, if you work with that example, what quality or what has that teacher done to, because if someone's listening to that example and is saying, yes, that's the kind of yoga teacher I want to be able to look at someone on the mat and speak to their body in such a way that the cue resonates with them, and I see the shift in their posture, and I know that we're making a connection. What if we reverse engineer, if we go back in time to what that teacher saying that cue had to do to get there, what are some of those things? Because this is exactly the difference between reading from the script and seeing a scenario that you could have never planned to see. And there it is in front of you, this opportunity, the student's out of alignment, quote unquote. And you now have to go into your repertoire to think, what can I say to help this person? I'm seeing it. I know this person is out of alignment. I want to help them. And I'm going through the Rolodex in my brain of all this stuff they told me to say, you know, like that's what I'm trying to I would love to know more about, because this really gets to how you prepare teachers for those scenarios. So what elements are part of that? If someone's listening and they're like, I want to be that kind of teacher, what qualities does that kind of teacher have?
Yeah, I think that it takes a variety of things, and certainly different learners learn different ways. And so when I'm teaching an anatomy component or an anatomy yoga training, it's I like to just start with like pictures, the skeleton, videos, 3D. Now we have all these amazing tools of like 3D videos, and you know, YouTube will just show you everything you want to, and in terms of like the visualization, but taking, you know, so I'm collecting as the trainer, I'm collecting different visual and physical things to look at. And then, so we start there, but then it ultimately, like we're saying, it has to get to the teacher looking at an actual body. And so, and no, you know, I think one of the big challenges is that the majority of people that we're going to teach have 2 legs and 2 arms and a spine and a head and 2 hands and 2 feet. And that's actually not all of our students, but if we just go with the majority that do have all the parts of the human body, they don't all look the same. And so I think it takes a lot of just practice at looking at different bodies. So what I was saying before, like we look at it in the, you know, the models, the pictures, understanding how things work, but then just looking at body over body over body again and again. And so getting different students on the mat. And if you're a teacher listening to this, like, and you're kind of like, where do I start? I would say, you know, grab your friends, your yoga teacher friends, your family and your loved ones that are willing to be your guinea pig, and just tell them to get in a pose and then really look and start. Let me say this too, start with just one thing. Like I always recommend start either the feet or the pelvis, the feet because it's our foundation, but the pelvis because I think it makes the biggest difference in every posture. But just practice looking like, what's the position of the pelvis? So our pelvis can tilt forward, it can tilt back, and ideally it's in the center. And finding what, and most yoga teachers can get that theory pretty quickly, but then looking at a pelvis, it's like, I don't know if it's forward or back or neutral. And some people's butt's bigger, some people's belly's bigger, some people don't have a butt. It gets kind of confusing. So you just gotta like really look. And one thing I'll tell people is most people, when they look at a body, the first thing is, I don't know. And so you've just got to get past that I don't know and look, because you will know. It's just gonna, I remember being a PT student and being like, I don't know. And then the teacher would be like, well, look. And like, I'd look and I'd be like, oh yeah, I can see it. So I think what I'm getting at is like the practice of just studying the basics and then repetitive practice at looking at different bodies and really trusting yourself. Trusting your intuition to be able to look at a body, to see what's happening, and then to give a simple cue, and then be confident in giving the cue that it might fail. I've been teaching yoga for, where are we now, 13 years, and I still say stuff. I'm like, nope, that didn't work. But it's being able to just make the mistakes and practice and practice and practice. And that's, where I think what you do, Karen, I haven't had the ability to like be in one of your trainings, but what you do and what I do is to give people those opportunities to be in a safe space to just mess up, and that's how you're going to learn.
Right. So another thing that I hear a lot from teachers is, I'm afraid people are going to get hurt in my classes. Mm-hmm. And I'd love to know what you think about that. Like when a teacher comes to you and says that, what kinds of things come up for you as a response, or how you counsel that teacher? It's just such a common, I kind of feel like it's sort of seeped into the vernacular of yoga teachers after I had started teaching back in 2002, 2003, when quite honestly, I don't feel like as teachers, we were really worried at the levels teachers are worried now. I hear this consistently. I'm worried people are going to get hurt in my classes. I'm worried if they're out of alignment, it's going to create an injury. And so I'm wondering, especially because you not only see people on the yoga mat, you see them on the plinth in physical therapy. And sometimes they might come in as a patient and say, I think I hurt myself in yoga. So you have some evidentiary proof, maybe not proof, but suggestive evidence that could potentially create a causal link, maybe. Although it's not a scientific process where the only thing they did was go to that yoga class and then the injury occurred. There's all these other variables. They were walking and sleeping and maybe going to the gym and everything else. I think, though, at the heart of it is this thread of like anxiety and nervousness that teachers have, directly linked to this narrative that now seems to be out there that is somehow resulting in a lot of teachers saying, to me at least, I'm afraid people are going to get hurt in their classes. And sometimes almost that becomes the motivation to learning more about anatomy. And I don't want teachers to try to learn, I don't want teachers to learn anatomy out of a fear-based motivation. I would much rather them learn it from the perspective as it's going to help me be a better teacher, a more confident teacher, a more empowered teacher around sharing my cues. So what are your thoughts on that?
Yeah, this kind of goes back to like the brain, the body, it's all connected and how it's all yoga. Because one of the first things, that topic comes up all the time when I'm teaching the yoga teacher trainings or the anatomy components of it. And yeah, I started with, I would say, more yoga philosophy. I would put this in the category of philosophy, according to the Yoga Alliance's agenda anyway, of, well, like, what is it that has you as the teacher feeling responsible for someone. And yes, of course, let me preface, like, you want to create a safe space. And if there's like water on the floor, you're not going to like set up a bad environment.
You just stand in front of the window.
Yeah. So I think that's obvious, hopefully. But I think that having that conversation with teachers to like get to the root of why is it that they're feeling responsible for people, because sometimes that just goes down the whole, route of self-inquiry and discovery of like, what is there to let go? What are you attached to? Which again, like, this is where it's like, we can't just separate the anatomy. And so we'll have that conversation. And often a lot of people discover that they don't need to be as responsible for others as they're allowing themselves to feel. So that's a big part of it. But then there is, like we said, the reality of like, how can we keep people safe? And well, let me say the other thing that I think of, my first yoga teacher training with Roger and Albina Rippey. Roger is an attorney, and that's the first studio I taught at. And I can distinctly remember him saying, like, don't ask people if they have, this is just his like business litigious mind at work, his business. But he was like, don't ask people if they have injuries at the start of the class, for that raises our liability. But then also, like, what are you going to do with that? If you're teaching 10, 20, I mean, that studio is huge. Sometimes I taught 80 students in a class there. Like, first of all, it's only an hour class. What if 40 people raise their hand? There's our hour gone. Nobody got any yoga in. But yeah, like, even if it's just one person that raises their hand, what am I going to do with that? There's really nothing I can do with that in a group setting. Obviously, in a private setting, you have that opportunity to maybe discuss and, go a little deeper. But so that's another thing. Like, a lot of times people, and I always bring up Roger in that story, and people are kind of like relieved to know, like, oh, I don't have to actually take care of every injury in the room. And then I think, the final piece is just like being confident in giving clear cues, so that people can be in actually listening to what you say and not feeling lost or out of touch. Because I think obviously there's repetitive use injuries that can occur in yoga, and those are a real thing. But for instant injury, if people are present and really listening to you and their body, the risk of injury is extremely low. It just is. Like, it's the whole point of yoga asana, in my opinion, is to get present to my physical body, to feel it, to listen to it, to identify what's working, what's not, and just be with it as it is and not force into something that would cause injury. And so that's a big part too, is I want to teach people how to teach that.
Yeah. I mean, I love that you mentioned the part about clear cues, because, juxtaposed with that scenario of opening up your class by saying, does anyone have any injuries? Which again, I feel like back many, many years ago, like when I started teaching when I started practicing in 1999, I would go to class and it was fairly common to get that as a show opener, like who has an injury, and there were people that would raise their hands, and there were these little conversations that would happen. And I feel like that doesn't happen as much anymore, unless the class is really small and it's like a small community studio where there's like real knowledge between the teacher and the students. But I love that focus that you said about cues, because isn't that sort of the thing that teachers can control to decrease risk? I can control what I'm saying, the words I'm using, which essentially are the cues I'm sharing. And I can do it in a way that, as you said, increases presence in my students, which, as you said, decreases risk because they're just more aware. And therefore risk goes down because they might not do something in an abrupt way or push themselves past a functional position to something that's beyond what their joints or muscles could handle. And I also add to that list, not only sharing really good solid cues to increase presence, also looking at your sequence and what you're asking people to do. So if I'm asking people to do tree, fine. If I'm asking them to do some sort of lotus variation that requires a lot of external rotation in the hip, that might not be as fine, because maybe a lot of people can't do that. And yet they can still get tremendous benefit from just doing tree.
Mm-hmm.
So I sort of add the sequence, what's in your sequence, to that. So I guess my thought is, and my question now to you is, if we take this a step further, so I can go in as a teacher, let's say I'm worried about people getting hurt. So now I'm hearing you both say, okay, so control what you can control sharing better cues, get more skilled in creating clear cues and sharing them. And also really look at my sequence, make sure I'm not kind of in that outer edge of asking people to do postures that might require a tremendous amount of mobility that aren't in that zone of like high degree of accessibility. Does that sort of cover it? And do I then just sort of need to be comfortable with the idea that people still might get hurt? Which sort of relates back to what I was saying before about the patient you see in your PT practice might indeed be able to link to their yoga practice. But is that, and I don't want to get into the liability aspect of it, but is that really the fault of the teacher? I mean, how do I know that person didn't have a hamstring tendonitis brewing from something else, training for a marathon, for instance, and they came to yoga, my class, did down dog, and that sort of was the thing that pushed it to a scenario where they needed medical treatment. So anything on that you can share, especially because you see people on both sides there?
Yeah, I think what you're saying is spot on about like something could be brewing already, and the timing is the timing. And even like something like a rotator cuff injury is very common. I'm not going to say very common in yoga, just very common out there. Like they happen all the time. I see people for that very frequently. And often I hear like, oh, I reached up to the cabinet, or it's a simple action that they recall. And they think it was that. And I'm like, no, it wasn't that. Like I can tell by, your biomechanics and how you function that this is a long time coming. And I think it's important for yoga teachers to really realize that like people are out there in the world. Your 1 or 1.5 hour class, whether they do it once or 5 times a week with you, is very important and very valuable, and really only a small percentage of that person's life. Right. And it goes back to what I was saying of like, check in with where is this sense of responsibility for that person coming from, because you're not totally responsible. And on the flip side, like what can you do, and what can you say, and perhaps at the start of your class, to really empower people to feel responsible for themselves? And I think the general message that I tend to deliver is like, you really are in charge of what's happening on your mat. And if you don't feel right saying what I'm saying, if you need to do a different pose, if you need to rest more, if you need to go get a water break, like you really letting people not just feel like they have permission to, but to actually feel empowered to take on their own sense of self-discovery and own sense of securing their body as needed. I think that's really important. And it can be challenging, because then I also, what I love in a yoga teacher and what I deliver in my yoga classes is taking people or empowering people to go somewhere where they might not go on their own. Because otherwise, why not just roll your mat out, at home? Like I know how to do yoga, but I still love to go to a yoga class. And so, there is a fine line there. But I think a lot of it too comes back to just trusting your intuition and really being with the people that are in your room or your studio and looking at them. And I think there's so much that we can learn that we can't express in words, but that if you just really look at students and kind of look and say, are they suffering? Like, if so, then you don't even have to give them a different cue. You could just direct them to a different pose or a different version of the pose or a adaptation of the pose. So yeah, so I think going, to summarize in that question is turn it on your students. What a gift to give them the ability to be responsible for themselves, and perhaps show them that they're responsible for themselves, not others.
Yeah, I really am glad that we had this part of the conversation, because I think this is another sort of outdated paradigm that's in the industry, that people are going to get hurt, that I need to ask the question beforehand to decrease the chance that they're going to get hurt. But just like you said, how are you really going to do that? By simply asking who has an injury, getting feedback. Well, let's follow it further. What are you going to do then? The person's going to give you feedback. Oh, I'm here and I have a torn rotator cuff. Okay, so what muscle? There's 4 in the rotator cuff. Where do you have pain? What like? There's no possible way, and that's why I say it's a paradigm, because it's done over and over again without teachers typically questioning, why am I asking this question? What result do I hope to get? What am I trying to prevent? And is asking this question going to allow me to prevent, in this case, an injury? Probably not. So why am I asking this question? But yet it's something that at some point years ago, people were trained to ask this question, and it comes from a good place. So I don't want to say it's not coming from a good place. And I also love that you brought up, and I just want to highlight this whole idea of sort of professional scope of practice as a teacher, what we're responsible for and what we're not. No one is coming to our class because we force them to. They're there of their own will. They sign a liability form to come to our class, and there is sort of an equal responsibility there. We have to be responsible for good cues, clear cues, a good sequence, keeping an eye on folks, and they have to be responsible for doing what they feel in that moment is within their capabilities. And if they go beyond that, well, that's not on me. That's on the person.
Yep.
So I just wanted to kind of pull those threads out, because if there is anyone listening who's still holding on to this fear that people are going to get hurt, and as you say, this sense of responsibility for their students beyond what is a functional, healthy set. I mean, of course, we want to be of service. That's baked into being a yoga teacher, but it's not that we take on this level of responsibility that makes us fearful about someone getting hurt. That's beyond. And just like you say, that's something that person could explore with inquiry questions and journaling and therapy and that kind of thing. Like, well, are you a saver type person in other parts of your life, trying to save other people instead of something different? So anyway, this kind of leads me to another curious question I have for you. And I think you're a really great person to talk to about this because of your physical therapy background. So one of the other sort of things teachers say is this kind of, well, only do as much as you can do. Well, don't push yourself if there's pain, oh, sure, rest if you need to rest. And yes, those things can be helpful things to say. They can come from a compassionate place and that sort of thing. What I'm wondering is, are there times, and we can kind of look at this through the lens of kind of the yogic lens, and we can also look at it additionally at the same time through the lens of like just pure physical therapy and anatomy. Are there times when, because presumably the reason someone would need to rest or come into child's pose or because there's some sort of pain, there's some sort of body response that is concerning to them, alarming to them, or maybe even preventing them from doing the pose. Let's just say the pose. How does, I don't want to necessarily frame it from the perspective of the student, but if we're always saying that as teachers, if we're kind of always giving that global permission and linking it to bodily sensations, i.e. pain, as the trigger, are we getting in the way of a student who might be having, let's just call it pain, discomfort, some kind of feedback, because that particular muscle being used in that pose is weak and needs to be strengthened or could benefit from some strengthening. So my question is, are we doing on a global scale a disservice when we're constantly saying this in this kind of permissive based, loving, compassionate way? Is that sort of another thing that teachers are saying, where we have an opportunity there to kind of educate our students about what's a red flag kind of pain and what's a, okay, this is a sign. Like, I'm sure when your patients come to physical therapy, they're not loving what you're doing, but you've got a physician's order and you know what needs to be done and you're pushing them through pain. You're not saying, oh, you know what, just lay here instead. So I don't want to lead you down a certain path, but I think you kind of know where I'm headed, but I really want your expert opinion on this.
Yeah, well, pain, and we've learned more and more about pain, we being just, through research and what I learned about pain 23 years ago in PT school has evolved tremendously. And it is so multifactorial that it's really difficult to identify the source of pain. And in fact, when I feel pain in my shoulder, it could be coming from my neck, it could be coming from my elbow, it could be coming from my chest. Like, pain can show up anywhere. And what we actually know is that pain is really only processed in our brain, and people are quick to be like, you're telling me it's just in my head. No, it's a real thing, and it's processed in your brain. So how I experience a sensation is different than how every listener is going to experience that sensation. And that becomes super challenging, because then it's like, I don't know what you're feeling or what I'm feeling. So I have moved into, both in teaching yoga and in my physical therapy practice, asking people, can you identify the difference between uncomfortable or something that causes discomfort versus pain? It doesn't work for everybody, but for the majority of the people I work with, they can get to a sense of, like, for example, this morning I was teaching somebody a simple hamstring and calf stretch for a tight leg. And, I looked at her, I said, how does that feel? And she was like, it kind of hurts. But when I looked at her, she, her answer was, it kind of hurts, not, oh, it hurts. She wasn't grimacing. There was no real signs of like red flag for me. And I said, can you describe it more? And she said, well, just like it's pulling in the back of my leg. I was like, okay, that's probably, again, I'll never know what she felt because I can't, but that's probably what we're aiming for. And I stuck with what I gave her. Versus other times I give somebody, a stretch or an exercise, and I see them like holding their breath and grimacing, and I'm like, okay, no, we got to figure something else out. Does that hurt? And they're like, yes, and so again, it's not black and white, and I wish it was, because then it would be easy to say, but I have found that distinguishing between pain and discomfort are quite valuable. And our bodies are made to adapt, and most of the things that cause that adaptation are uncomfortable. When I go into like I took a couple of days off of practicing to celebrate the holidays. I definitely had, more food and drinks in me than I usually do. And then I got on my mat and I felt the physical difference. That wheel that I did was really uncomfortable. It didn't feel good, but I was able to identify that nothing was painful. There was no red flag. It was just physical resistance in my body that I, was able to breathe deeply and break through, and then I actually felt better. So yeah, I think distinguishing between pain and discomfort can be really valuable. And I really hear what you're saying about that, like giving so much permission to rest in a practice can be disempowering. Like, I often teach teachers to check if you're like coddling your students. Like, are you just throwing child's pose out there because one student looks tired?
Yeah, I sort of feel like a lot of those phrases are fillers that teachers will say because there's discomfort with saying nothing, or they're nervous and they just want to say things to try to quell their own nervousness. So they're just the things that teachers say, but there's no real intention behind it, or there's an assumed intention because everybody says it. And every yoga class I've gone to for the 20 some odd years I've been practicing has always included certain things. It's just sort of, part of what teachers say. However, it's like the tree pose cue until someone starts to say, like, why are we saying this? And in this case, what I hear you saying is because there's different levels of pain and it's hard to say everybody's going to experience it in the same way, which we know they're not. Is it part of what we can do then to sort of educate our students around what sorts of things might be a reasonable feedback loop in the body to make one back off versus pushing forward? Like, how would we say that? Let's say we were teaching a particular posture where there was like a longer hold, and we knew in offering this pose, there was stretching of certain muscles that was happening, and it might be uncomfortable. Are there certain things we could say rather than just kind of those blanket terms like, oh, just back off if you feel any pain? Is there some other better way we could say it, knowing that it's a group of people and we're not working with people one-on-one where they can give us some feedback, in the moment? What would you suggest?
My go-to on that situation is guiding people to the breath, to their breath. Our breath is the link between the sympathetic and the parasympathetic nervous system that we do have control of, right in the moment. And if so, I'll guide people if I'm having them in like that long pose, like you were just describing, where that stretch may be a good potential for people to be experiencing. If I guide people to their breath and to listening to their breath, and not listening to the auditory sound, I mean, that may be part of it, but more listening and feeling their breath. Can you continue to breathe slowly at a controlled rate, or are you feeling a sense of holding your breath or having to breathe rapidly? Like, if you can't control your breath, it's probably your nervous system telling you to get out. And your nervous system is going to tell you to get out when it's uncomfortable. But if you can breathe, then your nervous system is going to say, oh, actually, she's right. It's okay. I can stay. But if you can't breathe, then back out. And what I encourage is, it doesn't need to be all or none. So if you're feeling an intense stretch, doesn't mean stop the pose. If you really feel like you can't breathe and you really feel like you need to abort the mission, let's not abort the mission. Let's reduce the intensity of the mission. And can you stay there?
Good point. Okay. All right. So I have one more scenario here. As you're talking, I'm jotting down notes because, I just love to be able to leverage your expertise in both worlds, the PT kind of clinical world and the yoga practitioner, yoga teaching world. What are your thoughts on how teachers can approach? And this sort of gets to when we were talking before about giving students agency and empowering them to kind of take care of themselves on the mat, which sort of promotes this scenario where both the teacher and the student are both at cause in this scenario of a class versus I'm teaching and I need to be responsible for everybody here, which lopsides it over to one whole side. What about when students say to teachers, especially in poses towards the ends of class where it's a little quieter, where students can maybe ask a question by waving a hand in a half pigeon type of thing. And the student says to the teacher, what should I be feeling in this pose? Sort of that, I'm looking to you to tell me what I should be feeling. I've gotten that, especially in half pigeon. I've gotten that particular question a lot. What should I be feeling in this pose? And it could be even in other postures, maybe where you're holding people longer, like frog pose, or I don't know, some other yin type posture if you're teaching a slower class. Kind of hard when you're teaching more of like a vinyasa flow. But even in those classes, towards the end, you have more restorative things. So what are your thoughts on that? Because it sort of shows that the student's engaged in what's happening, and there's a level of curiosity there. So you want to sort of, encourage that. And you don't want to necessarily, I don't think, say, well, you should be feeling this. So how would you approach that?
I would say, well, what do you feel? And that's where my students will know, like, that's because I'm with you, like telling people what they should feel, like going back to the one-on-one, like physical therapy or private yoga client, particularly with my physical therapy clients, a lot of times they are not people that exercise regularly, et cetera. And so I might direct them more by saying, do you feel a pull or something in the back of your leg if I'm teaching them a hamstring stretch? Or I'll just say, what do you feel? Like I'll be more directive to, like, I'm looking for something.
Yeah,
but even that, yeah.
But see, right there, and I just want to stop you here because this is like a really important point. To point out, you have to know what is happening in that pose to ask those directed questions, right? So if you don't know in this posture, the knee is in extension, therefore, the hamstrings are lengthening because their concentric action is knee flexion and hip extension. If you don't know that, you can't direct that student, right? So this is another one of those areas where what you know about movement guides what you say and empowers you as a teacher. So I just wanted to highlight that because I know it comes so naturally to you because you just know this in both situations. And this is, again, an area where I feel like teachers just sort of lean into stuff that teachers have said to them over the years. So they're just repeating it, but they're not knowing it.
Yeah.
And those guided questions to kind of help somebody who's maybe a little physically deconditioned, you can't just pull that crap out of your hat. You got to know what the hell you're talking about to ask those inquiry questions. So anyway, go ahead. I just wanted to point that out.
No, it's such a valid point because
I'm just like light bulb.
Yeah, what you're saying is so important because when you were first asking the question, like, what would you say to that person who's asking about like what they should be feeling? I think a lot of people, a lot of teachers will tell students by default what they feel in the pose. And they might not say, well, I feel a stretch in my outer hip. They might just say, you should feel a stretch in your outer hip. Well, I personally do feel a stretch in my outer hip in a half pigeon pose on my right side. I don't feel it on my left side. And what I feel in the pose, I know is different than what other people. But I can tell you when I'm in external rotation with 90 degrees of hip flexion, the piriformis is being stretched. And so therefore I can identify like a stretch is going to happen. But if it's a career ballerina, they might not feel that stretch. I mean, they may have an injury there. They may not, we don't really know. And so, yeah, what you're saying is so important, that having that basic understanding of anatomy is where you get to really ask the better questions and have a knowledge. And so, yeah, I might say to that student, like, well, what do you feel? And then they might say, I feel something pulling here. And I'd probably be like, yeah, that's correct. Or I'm not feeling anything. And I might be, well, like, that might be okay too. You might just have enough range of motion for this posture,
Exactly.
So.
Yeah. And I like that when you were saying before about when teachers will say, well, I sort of like feel this in this pose, like they sort of use their own experience, which sometimes could be helpful. They might say like, oh, when I do this, half moon, I feel a little bit of a twinge on the outside of my hip, but I know I'm sort of using my lateral hip stabilizers to hold that leg in the air, so whatever they might say. But I hear sometimes from teachers when I have conversations with them about why they're practicing with their class, this whole kind of, for some teachers, it's this whole battle. They don't want to practice with their class, but they are practicing with their class, and they sort of can't envision just speaking the cues and walking around. And especially if they were in a training where they were either encouraged or not discouraged to practice and teach together. And what they'll say to me oftentimes is, well, that's where I get my cues. If I'm practicing, that's where I'm getting what I'm saying. So I'm curious what you think about that. It sort of speaks to, when you're a yoga teacher, you're of course also a yoga practitioner. Is there like some metamorphosis where you walk into the room and you're like, okay, now I'm a teacher, I'm not a student, everything I say is coming from my teacher side? I've never really thought of this to ask someone, but I'm kind of curious what you think, because of course, if I, just like you said, if I share cues primarily through the lens of my own somatic experience, that's a very different way of teaching, even if I do it a little bit, than if I'm teaching more in kind of like the seer in meditation. I'm just sort of like looking at the students and speaking from the role of me as a teacher, not me embodying the practice. So I'm kind of curious what you think of that.
Yeah, I love this question. I've never really thought about this.
I've thought of it a little bit, but I've never thought of it as in detailed as this. And something you said earlier, well, when you mentioned about teachers saying, I oftentimes feel blah, 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 that's in this pose, that sort of got me thinking about, well, how, especially if someone's saying in half pigeon, what should I be feeling here? Like you said, you can go over and say, well, I feel la, 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 la in this pose. Do you feel that, So, is there sort of a role for us where we're kind of separating our own feedback in our bodies?
Yeah, I think there is. I hadn't, that's my first intuitional answer, having never really thought about it this way. And then, I feel like I hear a lot of teachers say this, like, you can't teach if you don't practice. And I'm on board with that, because, it's my practice inspires my teaching for sure, much more so on the philosophical and like the messages I want to deliver than the physical, I think.
Right.
And again, like my background, I came from, PT first. And so instructing people how to move their bodies was a skill I developed way before I even, considered being a yoga teacher.
Yeah. And that I would think too, it's kind of like if you have a friend who's a physician and let's say you even see that person, like you can hang out with them at a dinner party, but then when you go into their office as their patient, which probably doesn't happen that often, they're all business. Now they see you as a body, whatever their specialty is. So I sort of feel like in your role, both as a yoga teacher and a physical therapist, you kind of already must have that ability to like see someone in the PT context, and you're seeing them, yes, as a person, and you're also seeing them as, well, there's this person with this diagnosis and I'm measuring range of motion and I'm looking at their functional movement and I'm working with them sort of devoid of kind of who they are. It's kind of an objective look at them, and also devoid of maybe what I might feel if I had this kind of injury, or maybe I've had this kind of injury. So is there some similarities there with when we go in and teach yoga that we should kind of lean more into, almost as a way to, for those teachers listening who are practicing with their class and who are sort of looking at their practice as the well from which they pull their cues, where else can they go? Which sort of brings us back to the beginning of our conversation when we said, well, you really have to understand the fundamentals of movement.
Yeah, I do think it comes back to understanding the fundamentals of the movement and relating it to, my career as a physical therapist. As I mentioned, like I learned how to direct bodies to move before understanding what yoga even was, or that I even loved it. And what's coming up for me in this conversation is I've often heard people say, either tell teachers or teachers for themselves say like, I can't teach that pose because I can't do it. And I've never bought into that philosophy because if that means like, I mean, I've been doing handstands since I was 4 years old. So because I did gymnastics when I was 4 and got competitive. And so like my handstand was my best yoga pose. I rocked the handstand better than Warrior One on my first yoga class. And yet you don't need to be able to do the teachers that have taught me a lot about handstand. I actually could hold the handstand longer, but teachers have still given me tips and cues and alignment. And it's like through that practice. And I also on that topic, I have yoga teacher friends. I have a friend who uses a wheelchair. He has a lower thoracic complete spinal cord injury, which means he cannot use his legs for anything other than to help him transfer. I mean, there's ways to use them, but he has no muscle contraction. He cannot walk. And he has taught me amazing things in the yoga class. And he can't do the physical postures the way I do them. So I don't buy into the philosophy that you have to be able to do the pose to teach it. And I think what I'm tying this into is I also have taught, or had NCAA athletes, like football players on the table as a PT. Well, I can't throw the ball that way that guy throws the ball or catch it or do any of the things that they do. But I can look at the body and ask him to show me how he moves or what he needs to be able to do to be successful in what he wants to create for himself on the field and in his, sports career, and then use my knowledge and apply that. And I firmly believe yoga teachers have the ability to do that. And it's going to take something. It's not just going to happen. And you don't necessarily need to learn as much detail as maybe a physical therapist, because I do have the ability to look at any movement and analyze it, whereas yoga teachers can reel it into, start with 25 of the most basic common yoga postures, and learn those and, move into it, but not just learning the postures, learning the why and how the body moves. And then you'll find the next 25 postures are easy to understand. That's how like learning movement works. So
and it really goes back, and as we're kind of wrapping up here, it really goes back to what you said at the beginning. I loved when you talked about you don't need to know every muscle, you need to know certain key muscles and how muscles work and the fundamentals. And that was what you emphasized in the beginning of this conversation. And now at the end, where you're highlighting, you can work with a professional athlete. And even though you can't know what they do to the level of you having done it, you can analyze their movements. And that only comes when you have that foundation that you built to understand those fundamentals. And I really want to nail this point home, because I feel like so many times teachers are focused on way down the line what happens when you get to the point where you've built knowledge of those fundamentals in anatomy. You can do things like share really good cues and create really good sequences and be comfortable in a class when there are 50 people and they're all moving in different ways. You can feel comfortable with that variability and not worry that people are going to get hurt, and a whole bunch of other feelings and skills and that kind of thing. But it has to start with that knowledge of the fundamentals. That work has to be done. There really is no shortcut. And that's something that I always hear from teachers, because they'll come to me and they'll say, I have all these anxieties around teaching. Maybe people are going to get hurt, or I don't feel like I understand the why behind the cue. But when I'm asking them simple questions like, well, if I reach my arms up to the sky, what shoulder joint action is that? And they say, I have no idea. And that is not oftentimes their fault. It's that they just haven't been trained on the fundamentals. But somehow over the years, they've gotten way down the line and they're out there saying all these things, but there's no ability to go backwards and say, here's why I'm sharing this cue, because I know that in this pose, these are the joint actions, these are the muscular actions, these are the primary muscles at work. And so I just wanted to kind of I'm kind of like making a case for how important it is, for people listening that are like, oh, I never learned anatomy in my teacher training. And that was fill in the blank X number of years ago. And I'm in this place where I'm feeling this way about how my teaching is going and how I am as a teacher. And I don't know what to address. I don't know, should I just go get more hours? Should I just go, I'm not saying the answer always is go back and learn those fundamentals. I'm just, based on what we're talking about, trying to make that link so that if there are listeners out there who are teaching and they're feeling disconnected or they're feeling nervous or they're not feeling really confident, all those things, that could be an area to focus on.
Yeah, I definitely think so. And I've taught people that have been teachers for a long time, and they're actually I'll say more challenging to teach because they've like you said, they've just gone out there and they're really good at what they do because they've been doing a lot of it. And then sometimes they've just filled that space with things that don't really make sense. And so they have to kind of unlearn some of the things that they've habitually built on. And so the sooner you can get to learning those basic fundamentals and then speaking to your students from like a clear understanding, you're just going to be more effective.
Yep.
And then likely more confident, and then likely enjoy teaching more, and then a cycle of loving what you do, which I'm all for that, for every teacher loving teaching yoga.
Sure. So, all right. So as we wrap up here, why don't you tell people how they can find you? I think Instagram's probably, I don't know, you tell us, is Instagram or Facebook, like give us like a social media place we can find you, and tell us about trainings that you offer and how people can find out more and sign up for your trainings.
Yeah. My Instagram is Trish Corley, one word. And I'm pretty active on there. That's actually where Karen and I found each other. And my website is trishcorley.com. And Corley is Corley. And right now I do private sessions online, and I am in the process of revamping my yoga anatomy school. And so enrollment will be opening in 2023. It will be a membership-based training program. So it'll be weekly content coming out. You can join live sessions, or if you can't make the live times, the recordings will be available. So if you go to trishcorley.com and then go to anatomy trainings, you can get on the wait list to get information about when enrollment opens up. It will be early 2023. And I'm also on Facebook at Trish Rice Corley. So
got it. Perfect. Well, thank you so much. This was such a wonderful conversation. I am an anatomy nerd, self-professed, so I love talking about things like this. And I really just found it just so informative to talk to you and, kind of leverage your expertise in both areas, PT and yoga. And I look forward to having you on again. I would love to have you on again, and maybe we could focus on a particular part of the body. You mentioned rotator cuff, or learn more about your optimal postural alignment. So maybe we'll have to book another time within the next few months and do like a part 2.
Yeah, I would love that. And thanks so much. It was great getting to chat with you and learn more about you. And look forward to continuing to listen to your podcast and connecting again.
Cool. So today's Monday. This will go up a week from today. I always post new episodes on Mondays. And so this will go up on Monday. I'll record a little intro, and then we'll tag all this on at the end. And I'll send you the link, and then you can share it with your community.
All right. I'm looking forward to it. Thank you.
All right. Well, thank you so much, Trish. I will talk to you soon.
All right. Thank you.
Hi there. Thank you so much for listening to this latest episode. And thank you so much for being part of my community and for spending some time with me here on the show. I wanted to wrap up this episode with just a quick note. I have a brand new recorded workshop page, and I'm really excited to offer you an opportunity to watch recorded workshops whenever you want. I have the first installment of a workshop on the page on the website, and it is a short workshop all about how to give effective cues. And so all you need to do to watch this free workshop is go to my website, barebonesyoga.com, and you'll see the listing in the dropdown for recorded workshops. When you click that page, you'll see on that page the link to sign up to watch that recorded workshop. I'll be adding more workshops in the future to this page, and it's a way that you can access educational and growth information for teachers without having to make a workshop at a particular time. I love to get together with teachers live, both in person and of course online, which is where I'm doing most of my interaction with teachers right now. However, I appreciate that sometimes people can't make a workshop, or the time doesn't work for them, or they're in a different time zone. So I want you to know that this page can be a resource for you, so that as you're out there and you have questions about different things, or you have maybe a half an hour, 45 minutes that you want to devote to your continuing education as a teacher, you can just go to my website, pull up this recorded workshops page, and there will be resources there for you to take a look at. And all of the workshops that I share are all designed at, number one, giving you information, and number two, giving you the skills that come from getting that information. It doesn't do you any good if I'm just giving you information on anatomy. If I don't show you how you can use it in your teaching to grow as a teacher, to grow your impact, then it's really not very useful. So all my workshops will have that dual focus: sharing a little bit and then showing you how to apply it. So I hope you'll check that out. If you have any questions or feedback, definitely let me know. Just send me an email, Karen@barebonesyoga.com. Thank you so much for listening to the show, and I look forward to hearing from you. Namaste.